Hello, very good afternoon. Yeah, see, last class I introduced you to Kalikap. We discussed in detail about the mind of Kalikap. Okay, I hope you've gone through the textbooks that I had suggested. In case if you have any questions, doubts, please feel free to ask. If you have no questions, if the concept that I explained, if that's clear, we'll start with the other part of Kalikap. See, Kalikap is a deep acting remedy. So we'll take some time in completing Kalikap. Okay. Any questions or a quick revision? What we saw in the last class was we spoke of Kalikap. We started with anxiety. Then we also saw that they're very ticklish, duty oriented people, highly quarrelsome people. But the beauty of Kalikab is they will not stop coming back to the same physician, same doctor. Okay, very angry constitution, very rigid kind of people. Okay, so these were few important points. Highly routinistic, yes, duty bounded constitution. Okay, so now we will continue with Kalikap and we will look at the other interesting aspect of Kalikap. So now Kalikap, what I'm trying to explain here is when Kalikap is taken, for the proving purpose, which part of the body Kalikap acts and what exactly it produces. I hope you got the clue what I'm trying to tell you. I'm trying to talk to you about the sphere of action of Kalikap and the effect of Kalikap acting on those specific organs. See, like many of the polycrests that we discussed, even Kalikap is a remedy which has a very intense action. And if you look at the specific area where Kalikap acts is, it mainly has an affinity for the serous membrane, the mucous membrane, yes, and of course the serous membrane. Now, acting on the serous membrane, Kalikap mainly causes effusions. I hope you understand what the serous membranes are as a third year student, like the pleura, the pericardium, fine. Acting on these serous membranes, Calica mainly causes effusion. So there will be accumulation of fluid. Okay. So for example, when we look at the particular symptoms a little later, you see Calica will cause pleurisy, or Calica will cause pericardial effusion, or it can cause ascites, or it can cause synovial membrane also. There can be fluid accumulation. So serous membrane, and apart from the serous membrane, you also see Kalikab having a very good action on the mucous membrane of the GAT tract. I mean the GA tract. Okay. Now what exactly it does acting on the GAT? See, now what you see in Kalikab is it mainly causes inflammation. So as we unfold Kalikab, you'll see under the GIT that it will cause bad gastritis, it will cause slow digestion. I'll be telling this a little later. Now, lungs, again, a specific area. I would just share a small case here. And this case is a very interesting and a beautiful case. Unfortunately, I don't have the follow-up video of this case. One of our interns grandmom, she was admitted in a hospital in a very serious state. She had almost gone into coma, and the doctors there told it's no use keeping her here, you please take away. she'll not live long. Fine. Why do you want to keep her in the ICU? That's when this intern had contacted me, and she was already in coma, very bad state, multi-organ failure. And then, based on the reports that we had to prescribe because I did not get the conflict why this lady went into coma. All those details I could not get. She was somewhere in in a far off place, and the intern was here, and we had to look into the reports and we had to prescribe. Now, this is where Kalikab had helped this particular lady, this old lady. She had a pneumonia of the right lower lung. That was very obvious in the report. And then few more points were taken, and we had given her Kalikab. Kalikab, every 3 hourly it was rubbed over the dorsum of the hand. Kalikab dilution. And to the surprise of the hospital, to the surprise of the patient, this granny got up and she almost lived for 1.5 to 2 years after Calicab. And very recently, she died of myocardial infarction. She had come to our college OPD also after she got discharged from that ICU. And I don't know, it didn't strike to my mind. We did not take a video recording. Otherwise, anyway, it was our intent. She would have been very happy to permit me to share the case. I have the videos where the old lady was in coma. Okay, all those photos, videos we have. Though she beautifully improved, she lived a very normal life, lived for almost 1.5 to 2 years, and one fine night she had a massive cardiac arrest and she expired. Okay, no, she expired. That's fine, but you can't keep a patient alive for long. But what I was trying to tell you is, at least from the ICU, Kalika could bring her out, and she had a very normal, healthy life for next 1.5 to 2 years. That was a beautiful thing. So pneumonia is one very important symptom you have to remember. I'll talk to you about pneumonia in detail, but that case I wanted to share. So I couldn't resist, so I'm just sharing. Now, what you third year students need to understand is if our homeopathic remedies, if given correctly, it can do wonders even in treating terminally ill cases like people in coma. You can revert them back and they can come back to life. That's the beauty of this science. So lungs, again a major organ that gets affected in Kalikab will be heart. Heart again, I told you, pericardial effusion, which we just discussed. Not only pericardial effusion, fatty degeneration of the heart. We'll take it up a little later. The connective tissue, fine. The ligaments, the tendons, the connective tissue. Acting on the ligaments, tendons, the connective tissue, the fibrous tissue, Kalikab brings in a very good amount of relaxation. So this property of Kalika acting on the the connective tissue and causing relaxation can help us use Kalika in various clinical conditions. Like for example, hernia, uterine prolapse, okay, to name few. Sprains, you can think of Kalika. Yes, uterus. Not only uterine prolapse, Calicap can also be indicated in various uterine affections like menorrhagia, dysmenorrhea, abortions. Okay, we'll discuss in detail. Menstrual irregularities and abortions. To just give you a small hint, in depth, we'll take it up in the next class. And to understand next class, this information is very very important. That's why I'm just going through the slides very quickly. Serous membrane, mucous membrane, GIT, respiratory tract, heart, fine, and then the connective tissue, the fibrous tissue, and of course the uterus. Few major areas where Calica acts. Okay. The next heading. The next heading we'll talk of will be the ailments from. What are the causative factors of colica? So exposure to cold. Cali in the last class when I did the mind part, I told you Calica patient is a very chilly patient. They cannot tolerate cold. So you see that cold in Calica can bring in lot of complaints. Okay, there are many remedies. See, this is what I'm trying to tell you. You are in third year now. Slowly, you should start adding the other remedies which are having causation as exposure to cold as a causative factor. Can you quickly recall few remedies which has ailments from exposure to cold? I'll share a small case once you start sharing. Yes, very good, beautiful. Dull camera, good. Yes, agreed. Hepar, pulsatilla. Okay, fine. So now, 3 4 days back, we had a lady, a lady around 38 40 years old lady who had right-sided facial palsy. Okay. Now, the cause in this particular case, we did not get any emotional factors, though we try to dig in deep, trying to understand why her right side of the face went into a palsy. We are trying to understand, but unfortunately, we did not get any emotional ailment. Now the ailment we got was she got exposed to cold and then she had a right-sided palsy. Now why not left was the question that was also asked, but she got palsy on the right side. So why I'm trying to tell you is exposure to cold can give rise to a simple coryza or can give rise to something as severe as Bell's palsy or facial palsy. Now, this is the variation you as a young budding homeopath needs to understand. So, Alimsipa or an acute remedy will not cause something as deep as a Bell's palsy or a facial palsy. So, there you have to think of a remedy which is more deeper, miasmatically, a remedy which has a capacity to cause paralysis. Okay. In Calicar, at least you don't see paralysis. In Calicar, exposure to cold will give rise to few complaints like probably simple complaints like headaches. Yes, they can land up with sinus issues after getting exposed to cold, or they can land up with respiratory complaints like they can land up with cough. So exposure to cold in Calica will either lead to headache or will either lead to cough. Okay. Overstrain, overstrain, emotional strain or physical strain in Calica can be an ailment from sexual excess. Sexual excess. So again, sexual excess can have, excuse me, can have some quick remedies. Ailments from sexual excess. Third year student, I understand at least. Okay, very good, Nakswamika. I say, I mean, the speed with which you answer is very, stimulating. Very good. See, majority of you as a third year student, you have, narrowed down on Nakswamika. Very good. This remedy, Calica, also has ailments from sexual excess. Now, what happens in Calica after sexual excess? See, Naxwamika, they can either go into impotency as a result of sexual excess, or they might land up with a lot of other gastric issues or emotional issues. Okay. In Calica, they land up with something very unique, something very characteristic. Headache is one thing which you have seen. I'm not talking of headache as something very unique, but I'm talking of this. Vision goes weak. Okay, vision goes weak from sexual excess. Might be a little difficult to identify in clinics because very sensitive area that we'll be talking about, and sexual excess leading to vision weakness might be a little difficult to interpret. But if at all you are smart and if you could interpret, there are only 2 or 3 remedies, and the remedy that stands out is Calica. So vision goes weak after sexual excess is Calica. Ailments from ice creams. Okay. Again, any other remedies we can think of ailments from ice creams? Yeah, ailments from, yes, very good. Arsenicamal, number one remedy. Ailments from ice cream. You'll also be introduced to remedies like carbovage, pulsatilla. Yes, uh, carbovage, pulsatilla in your future classes. So do remember, and you can also include calicab. Ailments from carbovage, I mean, sorry, ailments from ice creams, and ailments from drinking chilled water, ice cold water. Ailments from drinking ice cold water. Again, some 8 to 10 remedies you have in your materia medica, and Kalikap is one remedy you have to remember. Now, what happens in Kalikap? They will have digestive issues. After they drink cold, chilled water, they land up with digestive issues. Okay, indigestion. One more probability or one more symptom you can have in Kalikap is they might have vertigo. So vertigo and indigestion coming after chilled drinking chilled water is Kalikap. Now this is what I was trying to tell you. Pneumonia. Now what why I put pneumonia under ailments from is Kalikap is one of those few remedies which has complaints after pneumonia. I'll repeat the symptom. Please listen to it very carefully. Not well since pneumonia. Now, how do you interpret this particular symptom in your clinical practice tomorrow? So, somebody has suffered with pneumonia, fine, and pneumonia has been taken care. Must be they have taken antibiotics, they have taken some treatment, and pneumonia has gone. But the patient very clearly tells you, sir, from the day I have suffered from pneumonia, my health, my health is not all that same. I'm suffering with something else. I'm suffering with this, I'm suffering with that. So, not well since pneumonia, you'll have to think of Calica. Okay. Now, to be more precise, what exactly happens in Calica after pneumonia? Generally, patients will not get sleep. Sleeplessness after pneumonia, the only remedy in our materia medica is Calica. I'll repeat this, it might be a little confusing for you. I'm not talking of pneumonia as an ailment. I'm trying to tell you not well since pneumonia. So they have had pneumonia, they have suffered with pneumonia, they have taken treatment, pneumonia has been taken care, but from then they're not very healthy or they have some health issues. You can think of Calica. Any health issues in general, think of Kalikap, or sleeplessness in particular, you can also think of Kalikap. I hope I am clear. Fine. Now, the next very important thing here, yeah, one second, this is blocking. So I'll just remove this. So another very important thing we have here is loss of fluids, ailments from loss of fluids. Now again, as a third year student, you should have a lot of remedies in your mind. Ailments from loss of fluids, which are all the other remedies? Which other remedies can you think of? Hmm? Simple remedies. I know because yeah, very good. Carbovage, good. Number one remedy, carbovage. You also have phosphorus, you have cinchona, okay. You have carbonimalis, you have phosphoric acid. You can also add, you have calcarea carb. You can also add kalicarb. Now, I am trying to tell you, yeah, Shivraj, he says China, absolutely right. Now, I was trying to tell you, or my teaching here is, we are trying to understand in carbohydrates what exactly happens from loss of fluids. Okay, loss of fluids in carbohydrates will give rise to headaches. So, headache which comes from loss of fluids. For example, a lady has been bleeding, fine, and she is losing a lot of blood, or there has been vomiting, there has been diarrhea, or sexual excess, or perspiration. So, any situation where a patient is losing fluids, there you can think of these remedies, ailments from loss of fluids, and one remedy will be Kalika. And in Kalika, they generally land up with headaches. They generally land up with headaches. Okay. So, ailments from abortion. Yes, this is also a very important thing you have in Calicut, ailments from abortions. Now, one top remedy for abortions and ailments from abortion. Now, when I say ailments from abortion, what happens after abortion? In Calicut, there are plenty of things that you'll see in Calicut. To start with, they might have, to start from the emotions, they might have anxiety. Anxiety which the patient has started observing after she has underwent an abortion. Anxiety after abortion, or we also saw weakness of vision. What else? Which was the other situation that caused weakness of vision in Calicut? Can you quickly recall? Which was other ailment that caused weakness of vision? We just spoke. Very good. Yes, good. Sexual excess. Yes, correct. Many of you are getting it right. So, weakness of vision, two things can cause weakness of vision in Kalikap. One is that sexual excess, or even after abortion, a lady might go into weakness of vision, or she might develop a very bad backache, or she might develop nausea, or she might develop vomiting. We spoke of anxiety a little while ago. Anxiety which comes after abortion. Okay. Now, last ailment from we have is ailments from suppressed skin eruptions. I'm not very sure what happens in Kalika. I was trying to check the literature. Though Kali has been mentioned under ailments from suppressed eruptions, I was not clear. Will Kali cause asthma? Will Kali cause nervous affections, gastric affections? So that clarity I could not get right now. Must be in future. If at all I get it, I'll share it with you. So two very important things, two very important topics that we have taken up today. One, we spoke of the sphere of action, and we went ahead and we spoke of what exactly Kali does acting on those specific organs. I hope that part you are clear. And second part, which we just finished, was ailments from some 7 8 ailments I've just tried to explain. And here again, we have gone a step ahead in understanding what is that effect in Calicut after they get exposed to these ailments. Okay. We'll just take a minute's break here. Break in the sense, I'm just giving a minute time so that you quickly recall what I've tried to explain, and any area you feel stuck or you feel confused, please feel free so that I can explain and we can move further. Any questions at this stage? Any clarification? Anybody who wants me to repeat, something that you have not understood? Feel free, because these two things are very very important: the sphere of action and ailments from. Okay, and if these two things are clear, then going to the next level will become very easy. Shivraj asked a question. What is this question? Effects on organs. See, effects on organs I've told you, like acting on the heart, it will cause acting on the covering of the heart, it will cause pericardial effusion. Similarly, acting on the heart per se, it might cause fatty degeneration. And we also saw on stomach, we saw on uterus, we saw on the respiratory tract. Okay, I hope I am clear. You, Shivraj, you want me to repeat all that, or what exactly you want me to do? Like, sphere of action we have discussed. Should I go back 1 second? See, this is something that we discussed. Yeah, these are all the elements from. So, I mean, this organ affinity you have just understood, and we have given you what exactly happens on individual organs like heart, the stomach or the GI, and of course the lungs. Okay, so I hope things are clear. We will quickly talk about the characteristic symptoms so that Once you understand the characteristic symptoms, things will be easy. Now, these are the PQRS or physical or general characteristic symptoms that I'm going to share with you. So if you see the apple, one apple looks different and that different, that unique is PQRS. We'll see what is unique in Kalika. See, as a practitioner, if or as a practitioner, where exactly Kalika I'll be using based on the particular or physical symptoms is what I'm going to try with you or what I'm going to share with you. See now this image if you see, can somebody quickly interpret this image? There's also a question, I'll take up that question. Okay. Vertigo is vertigo only due to consumption of yeah, of cold water. See, generally in Calicut, consumption of ice cold water brings on vertigo. That is characteristic. Yes, Padmini, that is it. Now, few of your friends have interpreted this particular thing. Yes, we have 1 second. Yeah, many of them. I can't read all of their names here. Padmini, Roshini, Ulas. Okay, good. Yeah, Deepika, few of them. Good. Now, what is that interpretation that your friends have told is if you just see the edema or the swelling or the dropsy in Kalika is very characteristic. It is mainly over the upper eyelid. Okay. So, this upper eyelid, you have swelling, back leg swelling. If you see this area, back leg swelling over the upper eyelid. Now, which are all the other remedies that comes to your mind when we show you this particular image? Which are all the other things that will come to your mind? Now, if it is lower, yeah, very good. Yeah, many of you have already gone. Good. If it is lower, it is apis mellifica. Good. So, if it is both upper and lower, then which is the remedy? Yeah, very good. Deepika, it is phosphorus. Good. Yeah, I'm happy. So, say I'll make things very simple for you. If it is upper, remember it is Kalikap. If it is lower, it is apis mellifica. In some patients, you might see it both in upper and lower, then the remedy is phosphorus. Simple. Okay. This is the first PQRS. Yeah, upper is Kali, lower is Apis. Both upper and lower is phosphorus. See, now, there is something very characteristic. If you recall arsenic amal, what was the time modality in arsenic amal? Time modality in arsenic amal? Time modality 48. 48 is which remedy? Good. Somebody has written 48. Arsenic amalgam is not 48. No problem. Which is the remedy which has 48 aggravation? Which is the remedy which has 48 aggravation? Now, arsenic, yes, Roshini, it is lycopodium. Lycopodium has 48 aggravation. Arsenic has 12 to 2 aggravation. Now, similarly, when somebody talks to you about callus, remember, you have patients coming to our clinic and telling, sir, around 2 o'clock, my sleep gets disturbed. I start with cough and I continue to cough till 4 o'clock. This is how typically they come to our clinic and they explain. Don't take these symptoms very light. When we were students, when our teachers would explain, we would feel funny. Who will come and tell you that my cough gets aggravated between 2 to 4? But as we started practicing, we started realizing. See, these are all symptoms, the provings which are happened on human beings. These are all subjective symptoms, and symptoms that the patient has experienced, and they keep sharing with you. So don't laugh at materia medica. Don't ignore materia medica. They are all very genuine symptoms, and you'll be shocked to see similar symptoms coming up in your practical life tomorrow. So 2 to 4 aggravation. I am not talking of PM. In Calicut, 2 a.m. to 4 a.m. Remember, 2 a.m. to 4 a.m. aggravation is Calicut. Okay, 12 to 2 a.m. or PM is arsenic amal. 4 to 8 p.m. is lycopodium. Very good. Okay, so we'll go ahead. Two characteristic symptoms I've given you. Now, this we have already discussed under mind of Kalika that they are very, very sensitive. What are they sensitive? They might be sensitive at various levels. The sensitivity in Kalikap is also to touch, which we spoke, very ticklish and all. More than ticklish, we also saw that they startle. They startle. Sensitive to touch. Touch brings on startling. See, there are many remedies which are sensitive to touch. The cause for the sensitivity is different. Arnica is also sensitive to touch because touch aggravates the pain. Here, it has got nothing to do with pain. Here, the skin itself is very, very sensitive, and then that touch can bring in so much of fear in them that they go startling. So, startling from touch. In deep sleep, you touch them, Kalis they startle. Very characteristic. You have to remember this. Okay? And the pains in Kalika. We have Brainia, we have Apis, we have Arnica. Each remedy has its own characteristic pain. The pain in Kalis will be stitching type of pain. Darting, which keeps moving, which comes suddenly, and pains that go suddenly. Shifting pains, darting pains, stitching pains, very, very, very characteristic. Okay? And bad weakness. I'm not telling you just weakness, bad weakness. Weakness before menses. Before menses, the lady goes into very bad weakness. You can think of Kalika. And there are three very important symptoms. One is pain in back, I'll repeat, pain in back, sweating, and weakness. These are the triangle thing you have to remember in callus. Back pain, weakness, and what is it, sweating, especially after abortion. After abortion, a lady complains of back pain with sweating, with prostration. Kali is a beautiful remedy. Never ignore. Similarly, menorrhagia, metorrhagia, bringing on back pain, weakness, sweating. The triangle. Think of Kalika. Kalika. Never forget. Never ignore. Now, the last symptom I wanted to highlight here is asthma. I wanted to get some images, but anyway, asthma in Kalika, very characteristic. The time aggravation is 2 to 4 a.m. More than the time, the posture. See, aggravations are of different type: seasonal, postural, diurnal, etc. So the postural aggravation in Kalika, fine. Now, generally, when they have asthma, they have to bend their head forward or bend their body forward, or knee elbow position. They feel better. For example, if this elbow, like touching the knee like this, they feel better, or placing the head between the knee. Three positions I am trying to give you: bending the body forwards, first part, or the knee elbow position is the second position I am talking to you, and the third thing is placing the head between the knees. So these three positions in Kalikab give them lot of relief. Gives them lot of relief. So this is with asthma. See, colocynth. Ayman is talking of colocynth. See, colocynth, it's mainly the colic pains. Colocynth has not much of action on the respiratory. It has more action on the GI, especially anger, especially an indignation, especially an insult that goes into bad colic pains, and bending double. Fine, yeah, bending double or some strong pressure, colocynth. Here I am talking to you about a respiratory affection, which is better by bending double, or this typical knee elbow position, or even rocking. You have those rocking chairs now, like this movement that I am doing also, rocking, they feel better. Okay, fine. So this is with the sphere of action, the ailments from, and of course the characteristic symptoms. Kindly go through all the three objectives that we have taken up today. If you understand all the three things now, our next class will become very easy. Next class will be about particular symptoms. Kindly go through the particular symptoms, and things will become very easy. So it's almost very close to bending double. This thing, fine, that knee elbow position, no, you are talking of. It's almost like that. But there it is pressure in colocynth. But here we are talking of a respiratory complaint. asthma feeling better by knee elbow position. And you'll be surprised that each of our patient might tell you a different position. Somebody might be better by standing, somebody might be better by bending head backwards, okay, somebody lying on the left hand side, fine, somebody lying on the abdomen. These are all the different positions which you should be aware. As and when the remedies come up, I'll try to tell you. Fine. But this is what typically happens in Kali. Bending forward or knee elbow position or placing his head in between the knees. Okay. So I hope things are clear. If you have any quick questions, I'll be happy to take it up. Otherwise, next class, please go through all these things so that our class becomes interesting. We can also have good amount of interaction, and you'll also understand the concepts much better. Any questions? No questions? Good. No questions, no problem. Fine. At least go through, and you can definitely come back in the next class. If at all you have not understood something, I'll be happy to clear. Okay. So anyway, thank you for joining, and next Tuesday I'll continue with particular symptoms of Calica. Thank you. Yeah, one second. There's a question, sir. You told one second. One second. What is this question? Sir, you told you'll tell how to read MM in third year. Yes, good. It's a, I mean, I'll prepare a small PPT for you. Now that I've started Kalikap, I don't want to break that continuity. We'll finish Kalikap, and before I start the next remedy, I will tell you how to read MM. And I told you in the last class, reading MM in first year, second year, third year, final year, as a practitioner it will be different. Okay, so we'll explore that area probably after I finish Kalika. Fine. Yeah, thank you.